Hi, I'm Dr MJ and I've been a dentist for over a decade. I employ dozens of associates at my practice, so I have a pretty good idea of what dentists and therapists want from their careers. I think I've figured out what's making many dentists unhappy in 2020. It's simply because you're not getting what you expected from your careers. In dentists and therapists, I see the most intelligent, dedicated and caring professionals. You want patients who appreciate you, and you want patients who will accept treatment plans and are happy to pay. You also want to be respected by colleagues, valued by patients, and free to do your best work, the work that really makes you proud. So what's going on here? There are roadblocks making it almost impossible for many to succeed, and unfortunately, most of them are out of your control. I mean, how can you be proud of your work if you have 10 minutes with a patient who wants to be anywhere except your dental chair? You tell me your patients often don't care about the work that you do. You say you're tired of all this drill and fill dentistry, but there's not enough opportunities in your practice. You say you struggle to get private patients to pay, and that consequently you can't really do your best work. So basically, the nature of dentistry in modern times means that you are seriously struggling to get what you want. I have a huge dental practice, but there is one room which is magic. In that room, I only ever see patients who want to be there. All the patients who walk in definitely know the difference between good and bad work, and I'm more than happy to pay for my creativity. The work I do in this surgery is often my best work, and treatment plans are accepted by almost everybody. I feel safe financially and I feel safe professionally. In fact, when things go wrong in the dental industry, I turn to this wonderful little place for shelter and a release. This is not a dental surgery, it's my aesthetic medicine practice. I realized that I solved all of these problems because I've always run an aesthetic medicine practice alongside my dental practice. I'm working with private patients, understanding how they think, not having to worry about the dreadful regulator all the time, feeling financially safe and doing varied work. My aesthetic practice balances my dental practice, and it will do the same for you. If you begin a career in aesthetic medicine, you could overnight solve some of the most pressing problems that you feel are restricting you in the way that your career is developing. Aesthetic medicine is 100% private, so there's no awkward conversations about fees. Aesthetic medicine is a luxury. It couldn't be further from drill and fill dentistry. Your patients will be queuing up to see you, and they don't only value your work, they need it for their happiness. Aesthetic medicine is artistic. There is no evil regulator, and you get to create breathtaking results using your creative talents. Aesthetic patients know the difference between good and bad work. So you will become known in the industry for being a provider who delivers the very best work. So if this sounds like something that you want, and I'm betting it does, take a look around our website and see whether the Smileworks Hub could be for you. We don't just teach aesthetics at the Hub, we launch careers, and our courses are only for dentists because you are the very best people to be delivering aesthetic medicine to patients. So consider a new career in aesthetic medicine. Start doing the work that makes you proud. See better patients, use your talents, make more money, and stand out amongst your peers. And make this the year you become known.